Ampullary cancer is a rare form of cancer originating in the ampulla of Vater. This small but crucial area is where the bile duct and pancreatic duct meet, emptying into the duodenum. Because of its location, ampullary cancer can impact several organs including the liver, pancreas, and small intestine. Early diagnosis and treatment are crucial for better outcomes. This essay will explore its types, causes, risk factors, symptoms, and diagnostic methods. Ampullary cancer represents a small percentage of gastrointestinal cancers, but has a significant impact. The ampulla of Vater controls the flow of bile and pancreatic juices into the small intestine. When cancer develops here, it disrupts these vital processes, leading to digestive and systemic problems. Recognizing the early signs and symptoms is crucial for effective treatment. Early detection often leads to improved outcomes. Individuals should be aware of the risk factors and seek prompt medical attention if they experience unusual symptoms. Ampullary cancers are categorized into two main types based on their cell origin. Understanding these types helps determine the most effective treatment approach. The first type is intestinal-type ampullary cancer, arising from cells resembling those lining the intestines. These cancers often grow slowly and are less aggressive. They are more likely to be diagnosed at an early stage. The second type is pancreatobiliary-type ampullary cancer, originating from cells similar to those in the pancreas or bile ducts. These cancers are generally more aggressive and spread quickly. Accurate diagnosis is crucial, and pathologists play a key role by examining tissue samples. This information guides treatment decisions and helps predict prognosis. The exact causes of ampullary cancer remain largely unknown, but genetic mutations play a significant role. These mutations can disrupt normal cell growth and division, leading to cancerous cells. When mutations occur in genes that regulate cell growth and repair, cells can start dividing uncontrollably, forming a tumor. In ampullary cancer, these mutations occur in the cells of the ampulla of Vater. Scientists are investigating specific genes and mutations involved, which could lead to new diagnostic tools and targeted therapies. Genetic testing could help identify individuals at increased risk, allowing for earlier detection and preventive measures. Several risk factors increase the likelihood of developing ampullary cancer. Age is a significant risk factor, with the disease most commonly diagnosed in individuals over 70. As we age, our cells accumulate more genetic mutations, increasing cancer risk. Men are more susceptible to ampullary cancer than women, possibly due to hormonal differences and lifestyle factors. Certain inherited syndromes like familial adenomatous polyposis (FAP) and Lynch syndrome significantly increase the risk. Lifestyle factors also contribute, with smoking being a well-established risk factor. Chronic inflammation in the digestive system, such as inflammatory bowel disease (IBD), may also increase the risk. IBD causes long-term inflammation in the digestive tract, which can damage cells and increase cancer risk. Ampullary cancer often presents with subtle symptoms in its early stages. Recognizing these early warning signs is crucial for timely diagnosis and treatment. One common symptom is jaundice, characterized by yellowing of the skin and eyes due to a blocked bile flow. Unexplained weight loss is another red flag and should prompt a doctor's visit. Loss of appetite and a feeling of fullness can occur as the tumor presses on surrounding organs. Nausea and vomiting are also frequently reported symptoms. Abdominal pain, particularly in the upper abdomen, is another common complaint. Itchy skin can occur when bile flow is blocked, leading to a buildup of bile salts in the bloodstream. Diagnosing ampullary cancer involves a combination of tests and procedures. Blood tests can provide valuable information about liver function and overall health. Elevated liver enzymes can indicate a blockage in the bile duct. Imaging tests like CT scans, MRI scans, and endoscopic ultrasound (EUS) are crucial for visualizing the tumor. CT scans help identify the tumor's location and size. MRI scans are useful for evaluating tumors near bile ducts and blood vessels. EUS combines endoscopy with ultrasound to provide detailed images of the digestive tract. Endoscopic retrograde cholangiopancreatography (ERCP) allows doctors to visualize the bile and pancreatic ducts. Biopsy, performed during ERCP or EUS, involves obtaining a small sample of the tumor tissue for microscopic examination. A pathologist examines the tissue sample to confirm the presence of cancer cells and determine the tumor's specific type and grade. While there are no guaranteed ways to prevent ampullary cancer, Certain lifestyle modifications and regular screenings can help reduce the risk. Maintaining a healthy weight through a balanced diet and regular exercise is essential. Quitting smoking is paramount, as smoking increases the risk of various cancers. Individuals with a family history of ampullary cancer or inherited syndromes should consider genetic counseling and regular screenings. Early detection is crucial for improving outcomes. Ongoing research is vital for advancing our understanding and developing more effective treatments. Clinical trials are evaluating new chemotherapy drugs, targeted therapies, and immunotherapy approaches. Researchers are also working to identify new biomarkers for early detection and prognosis. In conclusion, ampullary cancer is a rare but complex disease requiring a multifaceted approach to diagnosis, treatment, and research. Understanding the types, causes, risk factors, symptoms, and diagnostic methods is crucial for early detection and effective management. While prevention strategies are limited, maintaining a healthy lifestyle, quitting smoking, and undergoing regular screenings can help reduce the risk. Ongoing research holds promise for developing new diagnostic tools, targeted therapies, and ultimately, a cure for ampullary cancer.